Again, this is to supplement the lecture that's already posted. Went over the first half of the PowerPoint. This starts in with this certain urinary problems that children may have. The first being urinary tract infections. What puts a child at increased risk for a urinary tract infection? Urinary stasis, so if for some reason they're not able to void frequently enough. Females, because the urethra is closer to the rectum. Sexual activity, so if after sexual intercourse we encourage females to void afterwards. And then also uncircumcised males. Assessment in infants, they're going to be irritable, they're not going to feed appropriately, they may have a fever, they may urinate frequently, they may become dehydrated. Older children, pain with urination, back pain, blood in urine, and poor appetite. So lab values that we're going to get. We're going to get a urinalysis with a CNS, culture and sensitivity. What we will find with that is it'll be positive for whatever infecting organism caused the UTI. The most frequent is E. coli. It'll be positive for protein, glucose, ketones, leukocytes, and nitrates. Nursing care, we're going to encourage fluids, monitor I&O, pain control, antibiotics. You're going to make sure that they know to complete their whole course prescription of antibiotics. We're going to educate them to wipe from front to back in females, wear cotton underwear, drink plenty of fluids, no bubble baths, void frequently, and void after sexual intercourse. The urine also, just so you know, will appear dark yellow and cloudy. A lot of times, sometimes it'll have a foul-smelling odor. The urine can also have a high pH. Alright, next is enuresis. It's an inappropriate urination at least 2 times a week for 3 months in a child that's at least 5 years old. Primary enuresis is when a child has never been free of bedwetting, so they've always wetted the bed. And secondary is the child started bedwetting when they were previously potty trained. Risk factors are if there's a family history, it's more common in males, and then also emotional factors. So if you have a child that's been potty trained and all of a sudden they start wetting the bed again, you may, not always, but suspect some emotional factors going on, maybe some sort of abuse. Assess if there's any alterations in the voiding patterns, if there's any history of emotional stressors, such as have they moved recently, or are they getting bullied? Nursing care is support and education. Limit fluid intake after dinner. Maybe wake the child up during the night to void. Medication that can be given is desmopressin acetate. These children, you do not want to punish them for wetting the bed. Your ATI book does recommend having them change the bed sheets after they've wet the bed, but not actual disciplinary action for doing it. Acute post-streptococcal glomerulonephritis, okay? And you won't always see this attached to it because that's kind of a dead giveaway. It's an antibody-antigen response after a strep infection. So the patients that come in with this going on, you say, okay, have you had a upper respiratory tract infection or strep within the past few weeks? Assessment, tea-colored urine, and you can see on your slide there it's very dark. Anorexia, they're kind of out of it. Periorbital edema, hypertension, so there's swelling, hypertension. Labs, you're going to do a urinalysis and a renal function test. You're going to get a BUN and a creatinine. Nursing care, you're going to get daily weights, vital signs, provide rest, diuretics and antihypertensives, I&O, and antibiotics if indicated. Nephrotic syndrome. It's an altered permeability of the glomerular membrane resulting in protein loss to the urine. This leads to decreased serum osmotic pressure. Signs and symptoms are rapid weight gain, edema, and ascites. Decreased serum osmotic pressure results in proteinuria. Hypoalbuminemia, which is a low serum albumin level. That's the protein. Edema. And then hyperlipidemia, increased blood lipid level. Those are your cholesterols. Urinalysis is 2+ or greater for protein. Nursing care, we're going to allow the child to rest, do I's and O's, weights, monitor edema, measure abdominal girth daily, and that's to measure the extent of your ascites. Skin breakdown assessment, and elevate any parts of the body that may be swollen. A lot of times you'll see the periorbital edema, so if you raise the patient's head of the bed up, that helps, and a lot of times the swelling is worse in the morning, so when the patient wakes up in the morning from lying flat. Medications would be diuretics, such as Lasix, and corticosteroids, such as prednisone. There are no slides on the following, but I do want you to be familiar with bladder exstrophy. It's in your ATI book starting on page 275. And undescended testes. So with bladder exstrophy, the bladder is actually on the outside of the abdomen, I got sidetracked. It's exposed. So if a baby has this, it's going to be immediate surgery for correction, but until you can get the infant to surgery, you're going to want to cover it. And you cover it with a sterile, non-adherent dressing, and that's to prevent infection. Undescended testes, you can't palpate the testes in the scrotum. This may lead, sometimes you'll see this in preterm babies. If it is not a preterm baby and they do not descend, it does put them at increased risk for cancer. It can be inherited. They can fix it by surgery. In older children, they may administer the human growth hormone, not growth hormone, HCG. Some other things you may see, and you may have actually seen some in clinical. Hypospadias is the urethral opening behind the glands of the penis or the ventral surface of the penis. Epispadias is the medial opening located on the dorsal surface of the penis. And you don't want to circumcise these kiddos so you have enough skin left to fix that by surgery. Children become aware and very interested in the genital area and genital function and gender differences between 3 and 6 years of age. Because of this, these types of structural defects are ideally fixed between 6 and 15 months of age. Definitely before 3 if you can do it. Check on my volume here.
Had shown symptoms since 1994, and not a lot was known about this condition back then.
I was diagnosed when I was 7. Went to the doctor. They did a urine analysis, showed high protein.
With Chase, he started with the puppy eyes. Took him to the doctor and said, you know, what is this? And the doctor said, oh, it's allergies. You know, keep the windows closed, turn the central air on, change his bedding.
Started to gain weight. Initially, my mom just thought I was eating a lot. And I'm sitting there telling her, Mom, I'm not eating anything.
It's just dangerous, my disease. If I eat too much salt, bam, my face looks all puffy. I can't see a thing. It's like when you look into the sun and you can't see.
I got stomach virus. I didn't know what it was. I went to the doctor, and the doctor took my protein in my urine and said it was high.
FSGS is a disease of the filtration mechanism of the kidney whereby it doesn't work as well as it should, and it allows proteins, large proteins, to escape into the urine. The result of that is you take on water, you gain a lot of weight. The 3 symptoms of nephrotic syndrome, which is a general term for these diseases, FSGS is high lipids, edema, which is swelling, and the spilling of protein in the urine.
So the doctor said to me, it's like hitting the lotto in a bad way, because you have a disease that nobody else has. It's very rare.
We knew nothing about this. You know, our doctors knew nothing about this. It's unique, but it's a challenge.
Three years of intensive medication, steroids, cyclosporin, all the steps. They eventually failed, and I went to my first transplant. After I had gained 60 pounds of weight, trying to go through high school and leaving high school because I couldn't finish.
He's on Losartan, 150 milligrams a day. He's on Lipitor, 20 milligrams, and he's on 1,000 milligrams of Celicet and 800 units of vitamin D.
I get a lot of blood tests, and I have to take like 17 pills a day.
When Will has to go on steroids, everybody knows that our life is going to be chaotic. We can't go to the grocery store without maybe having a meltdown there. And the looks you get from people when your child's having a meltdown and you are at the end of your wits because you're dealing with this every single day, and all you need to do is go get a gallon of milk, and people are staring at you like you're a bad mother. You just want to say, my child's on steroids. My kid, you don't know what it's like, so don't judge me.
From a parent's perspective, he had the disease since he was 13. And by the time we recognized that he had this disease, his kidneys already had failed.
It's not really the disease itself, it's the medication and the side effects. But this, you don't have an option. You just have to take the medication and deal with it every single day, going up and down. It's really like a roller coaster. I was on peritoneal dialysis in 4th grade. Dad donated a kidney to me. Unfortunately, the disease came right back, did the same thing to his kidney. Those 2 years were probably the worst 2 years of my life. Probably very close to death a couple of times.
When I was 19, I started dialysis. My kidneys failed. My dad gave me a transplant a couple months later, but the nature of FSGS is it recurred in the transplant and it just destroyed the transplant. And I was on plasmapheresis. I had about 100 treatments.
I was scheduled to get my dad's kidney, but then we got a cadaver 3 weeks earlier.
I agreed to give my kidney, and I'm always willing to. In fact, today I just found out again that I'm able to give my kidney, and we're going to go down that path again.
My doctors from North Shore had told me that they wanted me to sign for a transplant with my father. My father went in, he gave me his kidney, and back then it wasn't laparoscopic. They sawed him in half, basically. They cut you right in half, from your belly button to your back, and they take out a rib, and they take out your kidney. And the next day he walked up to my room when the doctor said you shouldn't go anywhere, and I was in tears the whole time. And then they told me my disease came back. It just shocked me and my parents, and I didn't know how I was going to go on from there. So I had 4 kidney transplants, 2 from cadavers, 2 from family related, all with dialysis in between. Currently on dialysis now. I do nocturnal dialysis overnight, 5 nights a week. And in here is basically my kidneys. So this is a dialyzer. This is, the blood comes through these tubes. One end of these tubes will come, the red end will go into one side of a needle on one side of my body, and the blue in my arm, and the blue one will go into the other side of my arm. And the blood that goes through will, by osmosis, the bad stuff comes out of the blood into the fluid comes out and goes down the drain. The blood comes through the other end, goes down through the tubes to the blue side, and comes into my body. So this is how I live. This is basically it. This is a kidney. This is an artificial kidney as it stands today. This is how I survive.
This is a huge task to take, and I mean literally a disease that affects each person so individually. You know, you can have breast cancer and, you know, they pretty much know how to treat it, and, you know, but with this, each child responds so differently, each adult responds so differently to all the various medications.
And because there's no cure for FSGS right now, they don't even want to give me a transplant. I've been to multiple hospitals because of the risk of recurrence is so high.
The financial cost is enormous, and it is very dysfunctional for a family. Not to mention the high levels of anxiety and stress, because the disease comes and it goes in ways that we don't always understand.
Right now I'm at the crossroads of deciding whether or not I want to go on and stay on dialysis for 2 more years, which so far I don't love, or do another transplant, which also I don't love. So I have to pick door 1 or 2, which both are pretty horrible.
You definitely have your good days and your bad days, but ultimately it made me a better person. I feel like I'm taking all the hurt, the pain, so someone else won't have to. So this is why it's important to me, because I just hate to see other people deal with it.
I lean on my wife. If I didn't have her, I would not be here today.
My hero is my dad. For him, he never questioned the fact that he was going to give me his kidney, and that meant so much to me.
We have a nephrologist, Dr. White, who we lean on all the time. I think she's one of the greatest nephrologists that could be around.
I mean, I guess I say some close friends. They don't understand, but they're there.
Having my parents, you know, being there in the hospital and going to doctor's appointments are never a positive thing, ever. So having both of them there for me every time is nice. You know, a lot of people don't have that.
Heroes help people that can't help themselves. And there have been times where we have not been able to help ourselves. But knowing that the NephCure Foundation and the group of individuals that make up, from volunteers to the members to the NephCure staff, people that came to FSGS versus FSGS coming to them.
The reason why we have the strength to keep fighting each and every day, the reason why we have hope against the greatest odds, is because we can lean on the NephCure Foundation every day.
I think for FSGS patients, you gotta really, you gotta enjoy life. You can't let the disease take over. If you let the disease take over in your mind and let it beat you in your mind, then you're done. But if you don't and you just keep fighting, you're gonna make it. I think I'm living proof. I've been living with this since I was 19. I'm 45 years old. I went through college. I got a bachelor's and a master's while I had FSGS. I got married. I have 3 kids. I continued to work the whole time. So I didn't let it beat me.
Melanie doesn't know any different. I often wonder what it'd be like if my daughter didn't end up with this condition. And she had kidney function. And I'd be amazing to see her with kidney function at some point in time. It's been an awful long time.
I'd take over the world.
Sometimes in our lives, we all have pain, we all have sorrow. But if we are wise, we know that there's always tomorrow. Lean on me.